Hello and thank you for visiting the WoundSource Practice Accelerator on diabetic foot ulcers. My name is Miranda Henry, the editorial director of WoundSource. The WoundSource Practice Accelerator series is an immersive program designed to provide educational resources on a key clinical topic throughout the entire month. This September's Practice Accelerator theme is on diabetic foot ulcer management and will provide guidance on patient assessment, diabetic foot ulcer classification, treatment options, and preventative strategies for patients in remission. Diabetic foot ulcers are among the most challenging types of chronic ulcerations to manage given their multifactorial nature. Diabetic foot ulcers affect approximately 16.9 million adults in the United States. These wounds increase both the risk of amputation and mortality rates. These wounds are preceded by a compendium of risk factors including the presence of neuropathy, external trauma, infection, the effects of ischemia from peripheral arterial disease, malnutrition, and poor hygiene or self-care, among other factors. Screening for diabetic foot ulcers should be completed in all care settings, and self-assessment should be taught as part of the patient's self-management plan. Multidisciplinary care is crucial for patients with diabetic foot ulcers. Even after a patient's ulceration is resolved, the patient is at high risk for diabetic foot ulcer recurrence. This Practice Accelerator will provide clinicians with in-depth information on diabetic foot ulcers, addressing clinical issues associated with the management of neuropathic and neuroischemic ulcers. A holistic approach to patient assessment is provided, along with key information to support patient-centered decisions in the management and prevention of these complex wounds. This month's Practice Accelerator program includes free educational materials on diabetic foot ulcers for use in your practice. On this Practice Accelerator page, you can download our overview white paper on diabetic foot ulcer assessment and management. Click on the links provided to view our featured articles for the month on this topic. Visit our glossary for definitions of key terms to support education on diabetic foot ulcers. Follow WoundSource on Facebook and Twitter for a fact a day on diabetic foot ulcers. Share these posts with your colleagues to increase their knowledge in a fun way. You may also download our companion Quick Facts sheet, which includes these monthly facts on diabetic foot ulcers in a convenient handout format to share with your staff or patients. Join us for this month's featured webinar program, The Diabetic Foot in Remission, Strategies to Make Prevention Pay, presented by Dr. David Armstrong. And test your knowledge with the Practice Accelerator quiz, available for you to take at any point during the month. Look for future Practice Accelerator series topics over the course of 2018. Sign up for our newsletter to receive regular updates on upcoming events and resources at www.woundsource.com. Join us throughout this month to access our free program resources to enhance your approach to the prevention and management of diabetic foot ulcers, minimizing the impact these complex wounds have on patients' lives. Thank you.